I'm Dr. Stephanie Waggle, and this is
Miriam, I'm the office manager.
What inspired you to get into this the mental health field?
oh wow. Well, we have to go back well, I won't say how many years. A couple years. When I was entering into college, I started working at UPMC's division for dementia prevention. So mental health with older people, the geriatric population. That was one of my first experiences with mental health a couple of years ago, probably more like 17 years ago. And so I found it really important, even the little things that can be done. Like, for example, something as simple as cleaning somebody's glasses could actually help their mental health a lot, because you'd find with the geriatric population, they were hesitant to ask for help, and they weren't able to see. And if you're not able to see anything, then that's not going to be very good for your mental health. So just small interventions could actually have a really big impact on the quality of life. So that was just sort of the beginning. And then I did a variety of other things. I won't go on too long, but I worked as a psychometrist. I worked at a facility for mentally and physically disabled children in Japan. I worked at the Memory and Aging Clinic at the University of New South Wales in Sydney, Australia. I worked at a clinic for pilots. It was general health, but there was a lot of mental health involved. And that was in London with the Civil Aviation Authority. And I've been doing mental health for like a while, I guess. But the question is how did it all start? So that's why I got in my time machine and went back 17 years. And it was just, the small impacts that can have such a big positive outcome, like just simple as asking somebody how they're truly doing, not like you get on the elevator and they're like, how are you, but like an actual talk to me, and that can have a really big impact. So I think that the ability to improve somebody's quality of life just by these small interventions back then made me want to get more and more training and more experience to continue helping people's mental health. What about you, Miriam? She doesn't go as far back as I do, I suppose.
So for me, it started when I was in middle school and high school, kind of having my own mental health issues and realizing, especially as a brown woman, growing up, it's not really common in our culture to really talk about mental health. And so I started to advocate for it when I was in high school, kind of talking about my own experiences, but also making sure girls that look like me knew that it's okay to kind of have these issues and do something about it instead of just acting like it's normal. Dr. Waggle always talks about in her treatment plans, like just because something is normal or common or it happens doesn't mean you have to deal with it. So I always try to advocate for that. And when I was a senior, I actually joined Dr. Waggle's internship program. Wow, I feel old now. That was like 2016, 17.
Yeah. Oh, you do go back.
I was shadowing Dr. Waggle, she would have like activities for the interns where you would, do patient cases and stuff like that. That's when I kind of realized, okay, this is exactly what I want to do. Like, I love psychiatry, and it just really inspired me, and I just kept going up from there. And then when I was in college, I went to VCU, and I really continued to advocate, mentor people in high school and in college. Anytime anyone had something going on with their mental, they would come to me and I would tell them about accommodations that the school provides, getting help, going to VCU Health. There's nothing wrong with medication management. Just like with physical injuries, like if you have stuff going on with your mental health, that's something that also needs to be treated. It's something that also affects your everyday life, your academics. And I really started to really advocate for it, I guess. And it just continued, and I got stuck with it in a good way. And then I worked my way up in the psychiatry clinic with Dr. Waggle, became manager, started my own nonprofit that vividly still works with like pregnancy disparities and healthcare overall. But I also like to apply the mental health aspect, especially since Dr. Waggle got certified in perinatal pharmacology and PMADs. So that's like,
Humans, yeah.
you know, mental health issues among like the pregnant population. So, you know, I feel like it's starting to take off in society, like where people are acknowledging that mental health is a problem. And I want to be like the voice for the younger generation to kind of, you know, acknowledge it, spread awareness, and get help for it.